Hi, my name is Ahmed Duhad of Duhad, Klein, Bernstein, and EBM. Has your healthcare provider used you or your loved ones in any medical research without your informed consent? Did you incur unnecessary medical expenses throughout this entire process? Do you feel like the medical and healthcare system are taking advantage of you and your family? Do you feel like you've been lied to? Please call 1-800, EBM. My last client settlement was for $10 million. $10 million. Now, I can't guarantee you $10 million, but I will fight just as hard to get every single dollar that you deserve.
My name is Sydney Lou, and I'm from Arizona. I had to have one of my kidneys removed because I was diagnosed with a rare disease. After my surgery, one of Dr. Deception's assistants, Mary, asked me if they could keep my kidney here at the hospital to do research from time to time. I figured, why not? It couldn't hurt. At least I'd always know where my kidney is. Well, a couple years later, my disease progressed, and now it affects my other kidney. A research foundation contacted me and told me that they can help me find the cure to my disease. All they need is my old kidney. So I contacted Dr. Deception's office immediately and told them that I could possibly be cured. I asked them for my old kidney, and they told me no. I'm disappointed. I'm going to contact Guhad, Bernstein, and Klein to help me solve my case.
Hello everyone, welcome back to the Daily Planet, Special Edition, The Tissue Issue. I'd like to introduce you to our next patient, Mr. Bruce Wang. Hi, Mr. Wang.
Hi.
Mr. Wang was born with a rare genetic condition in which his blood produced a high amount of clotting factors. He recently moved to Ann Arbor, Michigan to receive special treatment from Dr. Deception. He thought he was going to be receiving standard treatment, however, he was wrong.
Yeah, so I met with Dr. Deception several years ago, and at first I was really thrilled that she seemed to take a personal interest in my health care, and all she asked is that I came in every week to get a blood draw, and at first I felt really great, but then after a while I started to get suspicious.
What happened, Mr. Wang? What made you feel suspicious?
Well, my symptoms weren't really improving. I didn't notice this until I went on vacation for 2 months, and at which point I noticed I wasn't feeling better, I wasn't feeling worse, despite missing the weekly blood draws. And what I noticed was that when I got home, that my doctor had called my house many times and left many voicemail messages stating that these weekly blood draws are absolutely vital to my health. And then in some of those messages, she went on and mentioned research and money, and at that point I was just uncomfortable with the entire situation.
That's very interesting. What did you do then, Mr. Wang?
Well, my girlfriend convinced me to call 1-800-EBM. It's the firm of Guhad, Bernstein, and Klein, and they do a lot of similar cases. And we contacted them to see if they could get to the bottom of this. And what we found out was shocking.
What Mr. Wang and his lawyers discovered is that Dr. Deception was actually taking Mr. Wang's blood, purifying his clotting factors, and selling them to hemophiliacs as a new treatment, and he was making a lot of money.
I mean, I couldn't believe it. I thought the doctor had my best interest at heart. I thought I was actually getting treatment, but it turns out that the doctor was deceiving me the whole time. She was using my blood factors for profit, for her own profit, and she didn't tell me about it. And I feel like an idiot for trusting her.
We tried to get Dr. Deception in here for an interview, but she was very resistant.
Dr. Deception, this is Clark Kent with Daily Planet. I have a few questions to ask you.
I have no comment.
Is it true that you stole your patient's kidney?
You want a story like that, talk to my lawyer. As I've said before, our institute strongly supports using these tissue donations for medical research. If every single patient wants to have rights over their blood or their saliva or whatever, how is science ever going to progress? These patients are just looking for money. And if we allow this to run rampant, next thing you know, researchers are going to be afraid of researching. They'll think that they'll get halfway through their project and patients are going to say, I want my cells back, or I want this data back. How do we expect research to go anywhere like that?